think we have a number of big organs such as stomach, pancreas, and liver. So we know that stomach has the function of stomach, everyone knows, mixing, crushing, and digestion. Pancreas is very, very important organ. Endo and exocrine secretion functions are there. But however, without pancreas, we can still live. I think there's an interesting question. And liver, digestion and regulation of metabolism. Without liver, can it live, survive? No, we cannot live without liver. So it's such an important organ. And there are a number of intestinal tubes, small and large intestine, and we'll discuss others. So this is our GI tract or gastrointestinal tract from mouth to anus. And there are some terminologies and anatomical named. So whatever I emphasize, you're supposed to, or at least familiarize and memorize. I think because this is kind of a medicine is a language, and then you have to get familiarized. Otherwise, to facilitate, you have to work with physicians and biologists, and you need to know the terminology. So that's why at first it maybe sound weird and strange because a lot of Latins are there, but over time you get used to it. So that's my suggestion. So I tried to put things you need to know, some of these. All right, so let's start with the digestive tract. So digestive tract, of course, it's a tract. It's kind of a tube of the system. There are functions and there are control mechanisms. So it's a valves and 이정련. Guess what that is? Specialized region of smooth muscle to control movement of the contents of intestines.
Sphincters.
Exactly. Yeah, this is a little hard to pronounce. So yeah, it's let me see. Sphincter. Sorry. Sphincters. So sphincter in Korean is called 괄약근. Okay. Like you control your urination or your feces. So okay. And what's very interesting, I have a chance to actually watch a German video which actually shows an actual human cadaver take out the digestive tract from the here, maybe right down to the stomach until the anus, took out, and then actually they actually put it there. And what would be the length? This is an amazing length. So I'll just tell you the answer, because it's so striking even to me. It's 8 meters long. So can you imagine from your gut, the length of this gut is like from here to the end of the room. It's just amazing. So even more amazing is actually the surface area, which we'll discuss later on. Okay. All right. So let's move on to the next. So the first, stomach. So stomach. There are a lot of interesting questions. Of course, we are very curious about this. And stomach is producing an enzyme and also like acidic, like highly acidic gastric fluid. The pH can be low as down to 1. You guys know that our normal physiological pH is 7.4. So 7 versus 1, 6 times. This is logarithmic, so 1,000,000 times like stronger acidic environment. So the lining of stomach, how does the stomach's epithelial cell survive? Because there are, you remember, there's like goblet cells in between these epithelial cells. They keep secreting a mucus. Okay, the lining of stomach includes a mucus, and that is called a mucin. Mucus layer. Okay, and also the digestive enzymes should not digest stomach itself while it's being secreted. So you guys probably remember pepsin decompose peptone into amino acids. So the enzyme passion, you can't digest stomach itself, so they secrete at the precursor form, and the name is Janice? Janice?
Professor, your slide is not showing.
Really?
Yes.
I'm sorry. Let me see. There's a chat. Okay. Yeah. Please tell me if you find any problem of this. Okay. Otherwise, I will not be able to know what you are seeing. Let's see. Thank you for the notice. News sharing. Oh, no. I see. You're looking at desktop. Okay. How about now? Raise your hands if you see. Great. Yes. Okay. Again, Janice. So enzyme pepsin, which is starting from precursor called pepsi.
Pepsinogen.
So yes, great. So you can see that's right, pepsinogen. So precursor form will not be active until it comes into this environment of low acid. All right. So that was the stomach. And next, let's go to pancreas. You guys know Steve Jobs from Apple died from pancreatic cancer, and pancreas is very important and sometimes devastating if you have a problem in here. So interestingly, pancreas has both function of endocrine and exocrine. Endocrine secrete, of course, you guys know, insulin into the blood, right? And then exocrine. If you look at the geometry of this, so they have a tract connected to this GI tract. So that is topologically, it's outside of our body. So whatever secretes here is exocrine. While there are blood vessels connected to all these cells in pancreas, and when they secrete hormones and insulin into the bloodstream, that is endocrine. So also very important, interesting thing is pancreas secrete an enzyme in inactive form, and that has to be converted into an active enzyme at the site of actions based on this microenvironment. So that's in general we call produce this. Let's see, Yuntami. Can you guess what this is? The precursor. Exactly, yes. Yeah, the name is just coming from enzyme. So it's called zymogen, right? Zymogen. So zymogen is inactive, so it will not chew up your pancreatic duct while being secreted. But once it's into the duodenum, okay, duodenum, they will be become active. And the liver, there are very interesting questions about liver. I think we still do not have artificial liver, unfortunately. So liver transplantation is probably, if you have a big issue of liver cancer or cirrhosis, a big issues of your liver issue, you may have to transplant because we don't have an artificial liver, unfortunately. Like as a bio or biomedical engineer, how can you make an artificial liver? Still challenge it to our human like science, and we have to know how it works. And interesting, liver is a very interesting, has interesting structure that, you know, all you guys know liver do detoxification, and liver is a very rich organ. Whatever enters into our body and bloodstream or whatever you eat through this intestine, it goes to the blood. And where it goes the first, it's a liver, because liver has a very important function of digestion and store, and especially neutralize harmful substances. So it actually have a lot of immune functions, immune cells. They're called the Kupffer cells there. So for scientists like us, it can be a little problem. Let's say if you are doing molecular imaging, you kind of develop a nice nanoparticle or molecular contrast agent, which is specifically bind to, let's say, targeting tumor. Unfortunately, whatever you enter into our body stream, it goes to river and it becomes uptake and neutralized. So that's a big issue. So people are trying to develop a nanoparticle or molecular contrast agent, which will not be uptake quickly in the liver. So liver is such an important organ, and the design is exquisite. So for example, all your food from your gut, and that rich nutrients and potentially toxins as well, they have to directly go to liver first. But think about it, and that blood goes into the liver is actually, from the heart point of view, it's from exit of the heart. So it's actually venous blood, okay? So that we call as this vein gets into the liver. But at the same time, liver cells called hepatocyte also needs arterial blood. So it has a very weird and interesting mixture of venous blood and arterial blood showering hepatocyte simultaneously. That structure is called sinusoid. And you look at this, the direction of this blood from the gut, which contains rich nutrients, which of course the liver make a glycogen through this, with this a lot of nutrient. So that because it's a venous blood, it's a vein, but think about this, liver works like a port, harbor, you know, whatever you see port, that means a harbor. For example, like Portugal, the name comes from harbor, okay? So that's why it's a name, we name it as a portal vein, because all the gut blood, that rich blood, while this is a venous blood, that goes to this port, okay? That's we call portal vein. Simultaneously, from the heart, the oxygenated blood is going into the liver through this hepatic artery. So you can see these blood directions are the same. They mix and wash this shower for these liver hepatocytes. And of course, going through this sinusoid, you know, you feed the liver cells with this nutrients and oxygen, and then they have to leave out of liver. So that's how you will name it, because it's kind of a big harbor city, port. So, and that you call this as this goes into the center of this unit, and we call central vein, and the blood out. While at the same time, this liver hepatocyte produces a bile liquid, and the bile liquid actually goes back to the opposite direction through this bile duct to go to gallbladder, and then helps digest, especially like fatty food substance. So this is an excellent design, and unfortunately, we haven't been able to reproduce exactly this functionality yet. So that's kind of your role to think about this problem and making it better, a better design. So, so that's what I said. Unique circulatory system is hepatic artery and hepatic. Let's see. I think you know what the Youngmin. Yeah.
Portal vein.
Exactly. This is like port, it's harbor. So liver cell receive mixtures arterial blood from the
heart.
Great. That's arterial, and venous blood from the
Intestine.
Great, intestines. Excellent. And we have this cord of hepatocyte along the path called the sinusoid structure, and the hepatic artery and portal vein now drain into
Central vein.
Excellent, excellent, excellent. And of course, bile ducts drain in reverse direction, somehow very, very interesting. All right, so that's kind of this very special arrangement of the liver system. And then let's go into the intestine. So intestine, those who have done some animal work, the first thing you have to do is actually do this anatomy course, that you have to dissect the animal, and then you open up the animal belly, and then you will find out all this GI tract and the organs attached to them. So when you are treating the animal, sometimes you have to give the drug into the animal not only like orally, but also by injecting drugs into them, especially, for example, like anesthesia for your experiment, for a live experiment. But then you have to inject this needle into the belly of the animal, and you gotta be very careful. You cannot do like this very shallow way, because then you may end up on top of this peritoneum. So that in fact is called a subcutaneous injection. That will be very slow. Sometimes when you need a quick, let's say, booster of anesthesia, you can't do that because it's not effective. So you have to make sure it goes pass down belly. And then what happens, you pass through this peritoneum. So that's why we call this IP injection or intraperitoneal injection. And interesting, this space is this black space. And when our intestinal organs are made, this is like a balloon, and then you push the balloon. That's how our organs, like this intestines and in livers and all these organs looks like. So what it means is there exists a peritoneal space, and whatever you inject there, and eventually they will drain down and enter into the heart, and then it gets into the circulation. So it's a little bit slower than, actually very slower than IV injection called intravenous. When you inject into the vessel, that's a super quick, because within minutes, it will just go through all our body and then get in touch with our cells. But this is IP. So the reason of this very interesting structure makes your intestine, if you look at it, it actually kind of, there's a layer connected. And this is actually very easy, interesting to see a blood vessels on top here. So for if you're doing in vivo imaging, and this called a mesentery vessels are very a good target. Okay, so you can see here the layers of a intestinal tube has a very interesting, I think, engineering structure. So that layer has two smooth muscle cells. One is along. So the smooth muscle is very interesting. So it has circumferential direction, which makes this peristaltic shrinkage, contraction, and extension possible. But at the same time, the tube has to move in one direction like this. And for that, you need the muscle layer direction orientation should be along this along this longitudinal to the tube. So that's where here you can see outer layer has longitudinal and inner layer is circular. So this is a very interesting engineering structure of the muscle, so-called muscularis. Okay, so and also like the stomach, in 1 minute, it like kind of this contraction about 3 times. It's very slow, right? While your intestine, the first part, duodenum, has about 10 times per minute. So it's like every 6 seconds, it kind of do the job for this contraction. And that we call, of course, peristalsis. Okay, so propelled food from the intestine. I think people have tried, you do this like 물구나무, like head to toe, like up, like you can do this this job, and then you drink water, and then maybe your esophagus can do this peristalsis even against the gravitation. I think that's a very interesting ability for us to digest. And this is small and large intestine. They do have a little bit of a different functionality in terms of absorption and of different kinds. Okay, so fluid balance. So there were very interesting questions, but think about it in our body. So we ingest food, about 1 liter of water is probably contained, and we drink water maybe about 1 liter, but our saliva, like we don't notice much, but 1.5 liters we are secreting. So I heard from doctors of head and neck cancer surgeon saying that when we are very old, unfortunately, our function of this saliva secreting glands are deteriorated, and we suffer from, we cannot produce enough saliva that causes So not only like smell, but also very problematic for digestion. So I think saliva, we didn't know about this. We are actually secrete a lot of saliva, and that's very, very important. And gastric juice from liver, from stomach, 2 liters per day. Pancreatic juice, 1.5 liter. This is amazing. And then bile fluid, like this amount is being secreted every day. But luckily, there are many people, actually, my colleagues have done surgery who took off this gallbladder, and you don't have bile fluid. So you will have suffering from side effect of so-called fatty stool. But it seems like it's not a big deal in terms of your survival. And intestinal fluid secreted. The point is, in the end, it's almost absorbed, so it's the same, okay? So in the end, intestines, we absorb most of the fluid. All right. So small and large intestine, I think this is just a very interesting structure to see. Small intestines is like finger-like structure to increase the surface area, while large intestines, it's actually the other way, invaginate, and it becomes a pit of this. And both are effective ways of making the surface area big. I do not know why one has to be this outwards, the other is inwards, which is, I do not understand. There may be some good reason for that. Interestingly, small and large intestine has a small diameter, and the length of this is a small intestine, of course, much longer than large intestine. As small intestine helps digestion and reabsorption, large intestine also helps reabsorption, but elimination of waste is its main function. Okay, and at the end, so what I want to point out is the architecture of this small intestine. Let's look at it more like engineering point of view. That you see, I think at some point I will point out this small intestine. If you look at the H&E stain, what you see, this is nice of phyli. It's one is a phyllus, and then this multiple is phyli. But if you look at this epithelial cells, at top of the epithelial cells, look at here. Let me see. Okay. Sorry, I think this is a phyli, and then epithelial cells. If you look at it, there's a microvilli. Unfortunately, it's so small that you cannot see with your light microscope. So that's why in pathology term, they call it as a brush border. It looks like kind of brush because it's so hazy there. But if you look at it into electron microscope, this is a beautifully elongated microvilli, which extremely increase the surface area about like even 20 times. So look at that architecture of this small intestine, 6 meter long, 4 cm diameter, and that circular force may increase about 3 times. And the phyli structure, like finger-like structure, increase the surface area by 10 times. But microvilli even make this one 20 more times. So you multiply this yourself, like 3, this actually 600 times of more than just typical surface area. So in fact, I think that's just a lot of surface area. You are doing your work job of your food intake. And at the same time, there are a lot of toxins potentially what we intake. So our epithelium doesn't last for very long. So let's see, Dorin, can you guess, can you see what's the rapid turnover rate of epithelium? So your
every 3 days?
Exactly. Great. Yeah, every 3 days. So that's something, every 3 days, you are kind of replenish your epithelium. This is just amazing turnover. I'm sure there are like active stem cells residing there. So largest intestine is more like drying organ because your poop is a kind of solid, because it absorbs remaining water. But at the same time, harboring bacteria, as we call, like this is kind of symbiosis, which converts dietary carbohydrate to monosaccharide so that we can absorb. So these are like something very cool emerging area, so for like microbiome study. And I think there's interesting questions and discussion. All right, so I think I don't want to spend more time over here. Rather, I will spend time for discussing with you guys. Okay, so let's go over the view about our questions. I think I enjoy very much. So let's see. Okay, Youngmin asked the question of, do humans need an appendix for digestion? What's the function of appendix? Okay, of course, in GI tract, this is something like unexplored area. And okay, Janice has a good answer. And actually, this is the answer also I found. Unfortunately, it's kind of a shame for us. We don't know yet very much of the function of appendix, while we still suffer from appendicitis. For example, my wife got this appendicitis and has undergone a big surgery like at midnight, and this is an emergency. So it can even like cause, I think if you untreat it, that big inflammation can rupture and even kill patients. Okay, yeah, unfortunately, this remains unclear. There are some studies that this may harbor protect the beneficial bacteria that helps the digestive system. So in fact, that's also what I found. So here, so in this, Google, our friend Google, and one theory is that appendix, the important thing is, we don't know it for sure. So I like Youngmin's question. This, we do not know. I think this is the accurate answer, but there are theories, for example, act as a storehouse for good bacteria and rebooting digestive system after diarrheal illness. Oh my gosh, okay, I think this is very interesting theory. The theory means this is suggested, this is have published maybe in peer-reviewed journal, but like we do need a more study to really confirm about this. And you see, other experts believe it's just a remnant from our evolutionary past. So that's a theory. So I would suggest, okay, I think this is very interesting. Rather, do they have a function or not? Let's see, Anho. I mean, this is a good time to this. So, like a biomedical science, so to figure out the function of appendix, hey, there's a theory like this. Can you suggest an experiment how to test this? I think that's what you actually need to do for your research, in fact. How can you test this? What's the hypothesis, and can you do some propose an experimental design for this?
So you mean how to test the functions of the appendix?
Yes, I think this is maybe a little too complicated. Just let's say we want to know what's the function of appendix. How would you develop an experimental design to test the function of appendix? Especially here as for harboring good bacteria. Okay, I would suggest
maybe we will maybe inhibit or excite the cells and see what's the difference when we excite or inhibit the cells in the appendix and compare the results.
Right. Yeah, you have a little bit of noise, so it's a little harder to listen. But yeah, I think your point is well taken. That if you want to know the function of appendix, this is what Youngmin is asking, right? What's the function of appendix? And there's a theory that maybe it harbors good bacteria. To know that, you have to design your experiment that, hey, with appendix and without appendix, like after appendectomy, to compare this. Of course, this might not be very easy if you are working with a human, because they're so complicated, not well controlled. Honestly, I do not know that mouse has an appendix or not. But let's assume mouse also has an appendix like human. Of course, mouse and humans are different, but study with the control system give an insight to us. So you do the appendectomy to mouse, let's assume if they have, and without appendectomy, and compare various parameters, especially in this case, a bacteria. So if you can harbor the bacteria with and without appendectomy, and you compare the amount and the species of the bacteria, and then see if that also has differences in the physiology of the mouse. So Youngmin, I think because you raise a good question, and everyone should think of like how to test, how to propose your idea like this, like maybe that function is this, and how to test this. That's your job to think of. Yes.
But in this case, as humans also have appendicectomies, we can look directly to humans to see if it's different or not with and without appendix.
Okay, yeah, I think Dorian has it's a good suggestion. I think this is more of a real, maybe relevant to human. So the actually good way to, I guess why we don't have much information is because many times we do not know when we will develop appendicitis. So to do it more right, we can design a longitudinal study of measuring the bacteria in the gut before appendectomy, and then measure after appendectomy, and see if this is true. I guess maybe that information comes from here. So Dorian, I like your suggestion. That's really important for us to gain insight. But it's sometimes very harder for people who have an appendectomy and people, the control group, because they are so different. It may be very hard to compare if the baseline has a huge variability. Okay, all right, good suggestion. Let's go through a little bit because I also tried to look for here a little bit. Maybe this one. So yeah, picture of appendix. You guys see, this is appendix. The length is about 4 inches, so it's a pretty long, very hollow ones. And you guys all know that I did have a friend, or even my family has an appendicitis and has to do the surgery here. And also there are tests, treatment. Yeah, treatment is appendectomy, this surgical removal, and antibiotics, because most of the time it's inflammatory issue. All right, good. Let's move on to the next discussion. Okay, Jung-Yun, where's Jung-Yun? Oh, there is. If the pyloric reflex has the problem, what do symptoms happen in our body? Oh yeah, I think it's a very good question. So if there's some problem of this physiology, what kind of problems we will have? In fact, I think we need to know what is a pyloric reflex first. Okay, well, let's take a look. So, okay, pyloric reflex. Yes, here. So what is pyloric reflex? Okay, pyloric sphincter distension, effective antral contraction. Oh, this might be a little difficult for you, but so the pyloric sphincter is at the end of the stomach before entering into the duodenum. So that kind of sphincter, that valve, has a reflex. Well, what is the reflex? Okay, so when this pyloric sphincter should open or close. Of course, when you ingest food and that food gets into your stomach, at that time you have to close your pyloric sphincter so that you can actually crush and do your gastric work. So important thing is, so when do you know to open or off or close? With the pH of chyme. So this chyme is a food stuff. And when there is more acidity in the stomach. So the point is the acidity of the stomach is a controlling factor for this pyloric sphincter to on and off. And one thing I just want to share with my experience, because I've done a lot of experiments giving mouse a drug through the mouse eyes, not eyes, the mouth. What you do, you have like this this syringe pump, but not needle, but it has to be blunt and actually very soft. So you give this mouth, when you give a drug, it's called a gavage. And this is called gavage needle. So when you give the mouse, you have to like kind of make this, and then you put it there. Be very careful not to enter into trachea, that will kill the mouse. So that you go into gently there, and then when you reach the stomach, in fact, the stomach has a reflex that it's closed initially, right? You don't push it because it'll injure the not pyloric sphincter, but the upper side of the sphincter. You give one drop of water here, thick, and then automatically this sphincter opens up. And then you give further down into the stomach and you inject your drug, okay? And then you take it back. So this is kind of I know from my own experience that this one drop of water actually opens up this sphincter. That's a reflex. And here, this pyloric reflex is at the end, the other side. So that is how do we open and close? Is here one suggestion, one knowledge here is a pH. And sometimes, because Jung-Yoon is asking about like the problems when there's a problem. So when you guys have baby, maybe the baby can have this pyloric stenosis. Stenosis means it's kind of a shrinkage, okay? And the baby can have a vomiting, which is like very forceful projectile vomiting. And also, then what is relaxing the pyloric sphincter? And the relaxation is mediated through release of inhibitory nerves. So it's, of course, everything is controlled by nerves, especially nitric oxide, and possibly VIP called the vasoactive intestinal polypeptide. So this one is also, you will find this VIP in neuroscience as well. So, and also looks like if there's a problem, there's this called gastric dumping. It's a medical condition, too fast than normal. So there are people, if this doesn't work very well, your food product, even it's too fast to empty your stomach and enter into the small intestine. Or you can also consider the opposite side, which is delayed gastric emptying, okay? So that can be caused by disease such as ulcer or tumor. So the pyloric sphincter at the exit may not open at the right time to allow food to pass through. So I hope, Jung-Yoon, so this is a very good question, interesting question, because we are talking more about normal physiology, but we have to know normal physiology to understand the pathology or disease. So this is at the junction of this question. Let's see, Doreen has a question about diabetes, suffer from diabetes, insulin, and does this mean that diabetes caused by a pancreas dysfunction? Where's Doreen? Okay, yeah, I mean, diabetes is like almost 10% of this developed country everyone has, and this is such an important topic. While our class doesn't cover this diabetes, we call mellitus much because it's not about pathology course, but this is such an important thing, several types of diabetes. So in our class, you guys should know about this. Okay, so I put a little bit here. Yeah, so the right name is called diabetes mellitus. Mellitus means sweet, okay, because this is about when someone is in diabetic condition, their blood has a high level of blood glucose. We call it sugar, but in fact that's a blood glucose, and that's kind of sugar. That's why it's sweet. You guys, like, I hear something like shocking news that if some people who are in severe diabetes, when they got up, their dog actually eat up the person's toe because it smells like sweet. And especially when diabetic patients, if it's severe, they don't have a good sense, so that they have a lack of a nervous system and doesn't function well. If his dog eat up his toe, he didn't even notice that. So this is kind of a story that, you know, I guess you guys heard that can happen in amputation of the leg. So it's such an important disorder. And why this happened? Two ways. One is the body. In fact, we just learned pancreas, but Doreen, pancreas is too big. Inside pancreas, there are Langerhans cells, and there are alpha cell and beta cell, which detects the level of insulin and produces insulin. And if the body doesn't produce enough of insulin, that is a problem, okay? This is called type 1 diabetes. In the past, we call this as a juvenile onset diabetes. If you look at people, I have a friend who are like in their 20s and 30s, if they're diabetic, it's more likely that they have this type 1 diabetes. It's part of autoimmune disease. Why? Their immune cells kill these pancreatic cells, which produces insulin. And the issue is you can't produce insulin. So even early days, you have to inject exogenous artificial insulin into your body. So that's type 1, which is much more rare compared to type 2. Type 2 is here, the second part, responding normally to insulin. So insulin is there, but your cells doesn't respond too well, causing blood sugar or glucose to be high. All right, so hopefully that answers a little bit. I think I have a little more search over here so that it helps you guys to understand types of diabetes. As I say, most of the people who are diabetic are type 2, and this is more for not the production of insulin issue, but your cellular aspect of controlling blood sugar. And there are even those people who are pregnant women tentatively can have a diabetic status that we call gestational, or we call type 3. Okay, so this is just kind of important to know about this, like type 1, 2, 3. So as I say, type 1 is kind of an autoimmune reaction, meaning that the body, your immune cells attack your pancreatic cells that produces insulin. So this is actually quite devastating disease, because for the rest of your life, you have to depend on external insulin. All right, so that's is the other. Okay, yeah, all right, that's what it is. And then let's see, Hamza Sharif, Hamza's question. Let's say medical surgeons are nowadays replacing pancreas. Actually, not replacing, removing is probably more proper word, because we don't have artificial pancreas yet, okay? And even gallbladder of critical patients such as cancer, affected organs, or having inner stones, right? Is that artificial organ have the ability to produce enzyme? Very good question. As far as I know, we don't have artificial pancreas, but as we learned from this recombinant DNA technology, we can produce human insulin out of this factory of bacteria as a factory. So we produce an insulin so that people can live like without this issue, like especially type 1 diabetes and also type 2 diabetics. When that gets severe, they also do need the insulin injection too. So regarding this, actually it reminds me of actually my friend who died a few years ago due to pancreatic cancer. This is such a devastating disease. And I think it's good to know about this, because in your lifetime, I think you'll get to know people who actually undergo pancreatic cancer. And pancreatic cancer is devastating because the most devastating out of all kind of cancers, because 5-year survival is less than 5%. So they die within like 1 or 2 years, unfortunately. So then we have to think like, what's the treatment? What's the current status of our medical technology to cure or treat this? So here it is. So as Hamza asked, pancreas is surrounding your stomach. And if you look at their anatomy, pancreatic, oh, let's see. Okay, I think I have that. Where is the? Okay, so the pancreas, the duct is right connected to this right bottom of the stomach. So it's in duodenum, and that part is close to liver. And so liver has this bile duct, right? Gallbladder connect to this small intestine, because that parts are so close each other. You know, the big killer of why pancreatic cancer is devastating is they do metastasize, meaning the cancer cell crawl out. Majority of the time, by the time you got this finding, it actually invades the nearby liver and gallbladder simultaneously. That's why it's very, very difficult. If someone can undergo surgery, that means it's actually lucky case. Many times, actually more than half, you can't even undergo surgery because it's just too late. You cannot do the surgery. But so that's why I want to share with this as a total pancreatectomy, meaning that total means you just take out the whole pancreas head and tail. Not only pancreas, that's not enough. You want to remove the entire pancreas plus even spleen, gallbladder, common bile duct, and portion of small intestine. It's a huge surgery, very difficult surgery. Even with that, the survival rate for 5 years is between 10 to 25%. I think this is a lucky case, even in this case. And we'll discuss this later. Then, you know, the resection is not enough. Cancer cells are around and you want to kill them. So you want to augment, or you want to support. So that augmentive treatment we call adjuvant, okay? Adjuvant is after you do this surgery, you want to give a second punch to cancer cells. So that's why it's called adjuvant. Chemotherapy may improve survival as a routine. So that's something what we do. And I want you to hear about Whipple procedure. As I said, this a big surgery is called Whipple procedure. And that's actually good to know what is Whipple procedure, which is because it's so big surgery and potentially curative, meaning that if it's a very early stage, yes, potentially. But unfortunately, you see the reality is very, very devastating. And so sometimes we just do palliative surgery, meaning that the tumor blocks and dysfunction. So growth of tumor, just cut down, resect the tumor so that the patient can be relieved for the rest of their life. So that's a palliative surgery. So what I want to show is a Whipple surgery, that or Whipple procedure is a pancreaticoduodenectomy. duodenectomy. So the name is so complicated, but you have to sort of divide as a pancreatic. So you remove pancreas and duodenectomy. So meaning that you remove the connecting upper part of small intestine called duodenum. So this is a huge surgery, all right? And of course, there are a lot of complications for this. So when you remove, it's called total pancreatectomy. So that's what's a Ripper surgery. You see this gray color, actually it may not be easy to see Ripper procedure. You see, if you found tumor in this head of pancreas, you remove all of this part, including gallbladder, this duodenum, of course, this pancreas, and part of this bile duct. Okay, so I think that's all right. So that's something I want to share with you, discuss. And Fong, where's Fong? Okay, good. Fong asked very interesting questions. Why can strong acid in the stomach kill Helicobacter pylori bacteria? Very interesting question. I think if you asked this question maybe decades ago, you may get Nobel Prize, because the discovery of, hey, bacteria can live in your stomach, that discovery led to a Nobel Prize, because it turns out that this may be a cause of major stomach cancer. And of course, this is such an interesting phenomenon, because from what we know is with this low acidic environment, you know, what your food and whatever outside cookies, they harbor bacteria, and they just right away are being killed in your stomach because of the low pH. But this bacteria is very special, and why they can survive. I think Anho and Nat has a very good summarized answer, which I think you guys can read too. First, Helicobacter pylori can produce enzyme called urease, and that neutralize the pH so that this can survive. Very clever, right? And the second is what not found is this bacteria, the cells of stomach lining has frequent turnover. Okay, so this second is related. This bacteria is smart enough that when they go into the stomach, they probably crawl beneath the mucus layer, because outside this is acidic, beneath the mucus, in between epithelium. So they live there, and so that they can prevent from this harsh environment. But the problem of that bacteria is the stomach epithelium, like in other GI tract, they slough off like every probably ton of, I don't know, every 3 days or not for stomach, but very often. So that can be a problem for them to survive. So, you know, this is a very interesting, good question. And so that survival of Helicobacter pylori in gastric acid, and that's the dilemma. I think this was not found, and urease is another thing. And of course, the majority of Helicobacter pylori will be killed by stomach acid, but probably some of them can survive by expressing some tolerant genes. Of course, that gene is relevant to producing urease, secreting this urease enzyme. And I think we have to also consider about this treatment. So let me tell you my story, that like even within a month, I went to the health exam, and I did this upper GI, so this gastric endoscopy. And the doctor told me that, hey, this nearby this sphincter, there's a little pinkish. So he said to me that, hey, this is a sign of potential Helicobacter pylori infection. And he said, like 60% of all Koreans have this. And this may cause a gastric cancer in the future. Would you like to do the treatment? So that's his question. And I was asking, hey, if I treat with this, will I be free of gastric cancer? And the answer is no. That's eventually led why I didn't get the treatment. And what was the treatment? Here it is. Because for people who have family history of gastric cancer, I think this is serious and very important. And the reason, another reason why I didn't get the treatment is because it's not confirmed. And also there are side effects which might be even not great. So antibiotics to kill bacteria in your body, so it's more systemic treatment. You guys all know that the biggest challenge, one of the biggest challenges in modern medicine is in fact the resistant bacteria, like called super bacteria, which will kill a lot of patients, especially in the clinic. So, and if we don't want to use a lot of antibiotics whenever necessary, because it will develop resistance and it will affect when the critical period or we don't respond to proper these antibiotics. So that antibiotics is one, and the other is reducing the amount of acid in your stomach so that blocking pumps. So that's kind of a treatment. Other thing, yeah, treatment of Helicobacter pylori, at least 2 different antibiotics at once. I think we pay attention for that because one antibiotic may leave the bacteria to develop resistance, they become dominant, and the antibiotics doesn't work anymore. Okay, so here you can see a combination of antibiotics and acid-reducing proton pump inhibitor. So I think that's an interesting ways of treatment, right? Let's see. Other. Yes. Okay. Yeah, I think that's things about this. And next, Youngmin. Youngmin asked a question. I think it's quite interesting because I heard the mukbang video is very popular. They have a lot of subscribers. Youngmin, you're a biologist. Why don't you explain your question again and then your thought on this? Because I do not know the truth, in fact. By the way, everyone knows mukbang? Raise your hands. There are, yeah, YouTubers who eat a huge amount of food from your YouTube, okay? Youngmin?
Yes, Professor.
Yeah. What's your thought of this? Is it all fake or?
They have very huge stomach because they eat 4 kilo
4 kilograms of what?
meat,
Okay.
pork, or beef.
Yeah, I'm also curious about that. So, yeah, Anho found out, yeah, there's a trick for that. So I guess that probably is, maybe not all of them, but maybe true. And Dorian has also another very plausible answer for that. Stomach, normally, 1 liter is defined the amount of like what our stomach can hold, but in fact, the stomach can extend quite much, can grow up to 4 liter. Yeah, for maybe for sumo wrestlers and sumo players, they eat a lot to gain their keep their weight. So I think it's probably very true. When you get used to eat more and more, your stomach adapts and become larger than usual. So, you know, in modern world, I would, as to answer Youngmin's question, if possible, bring that YouTuber and take MRI, measure their stomach, especially right after they eat food. That would, unless it's a fake, I think that's very interesting. So it's a very curious question. So I also look for that because it's a little bit we all know that we eat more and more, our stomach can actually get bigger. So overeating causes stomach to expand beyond the normal size to adjust the large amount of food. I think that's possible. How much? Up to 5 times its volume. Oops. Yeah, stomach can expand. What about the stomach? The liquid stomach can hold. It's a human stomach have a volume about 1 liter. So that's why we define that 1 liter. And but they can hold more food and distend it. So normally your stomach even can hold 4 liters. So Youngmin, I guess 4 liters water is about 4 kilograms. So maybe maybe difficult, but maybe holding 4 kilograms of meat may be possible. Okay, I think that's quite interesting in that regard. So yeah, it's just physiological. This is a very I think interesting question, and this is for fun, but who knows? A serious scientist can try to figure out whether it's fake or not by taking medical imaging, which can actually measure the size and volume of stomach. The mukbang YouTuber may have adapted already a huge, like 4 liters of stomach by themselves. All right, so let's go into the liver question. Okay, so Pimlat asked a question of partial liver removal surgery called hepatectomy. You know, hepa means liver, tum means cut. So hepatectomy is kind of cutting off a liver, especially when there's like liver cancer. So will the patient liver function at full capacity or decrease with the amount of liver remaining? Very, very interesting question. And I think Doreen found out several weeks, the liver can regenerate depending on the people and the amount. I think this is true. And very interesting, liver is the only our body organ which can regenerate that much. So I think this is quite interesting. So I also look for that part a little bit. So partial hepatectomy. So you can have a full hepatectomy because you cannot live without liver. Okay, so but liver regeneration, how does that happen? I guess the important thing is that the stem cell liver precursor, and this is a remarkable capacity to regenerate even after injury or like surgery. And what's known is you can remove 2/3 of your liver. That is an amazing ability, right? To grow back. So within 3 months of your operation, they come back to its normal size. I'm still very curious, how come they remember their normal size when they regenerate? That's just amazing. So even after, yeah, this is even more shocking. Even 90% of your liver removed, they can regrow to a normal size. This is just an amazing ability. But then we have another question about, so when they regenerate, do they remember their original like shape? That's a question. Let's say Janice. Where is Janice? Okay. Yeah, can you guess? Let's say we cut 2/3 of your liver out, and then you wait for 3 months. Would the shape of the liver the same as the original? Question for you, because you raised this question.
I think maybe it's regenerate to the original shape, but it's not 100% original shape.
Yeah, very political answer. Okay. Yeah. So I think here is this So the process of regeneration in mammals is mainly compensatory growth because only the mass of the liver is replaced, not the shape. So I think what you just say, I guess, is completely true. So for people who are considering about how to regenerate organs and developing ways for organ regeneration, liver would be very important target to study deeper, right? Because this has the ability for that. And intestine, Uju is asking what triggers peristalsis. It's automatic when food molecule entering intestine. Very interesting open question. Where's Uju? Oh yes, there she is. So yeah, I mean, peristalsis is such an important function. Only those who, how many of you who have experienced constipation, raise your hands. Nobody? I mean, 변비 in Korean. Who have experienced constipation, raise your hands. Oh, that's great. You guys are all very healthy. So constipation is very, very painful, okay? I also know about this. And so peristaltic function is very important. It's known that, you know, chronic pain patients, if it's intractable pain, the patients take opioid drug. So 마약, right? The opioid drug, the side effect is known as a constipation, a very worse than bad constipation. Why? The opioid will stop peristalsis and the patient will just suffer. Okay, so that's something I do know, that how important this function is. So what triggers peristalsis? Uju's question. Let's go back to Uju. And this is a very interesting phenomenon in physiology, that there are reflexes within the enteric nervous system. Enteric system means our intestines, the nervous system, we call them as enteric. And even there are a huge number of neurons residing throughout our GI tract, which is a little, I think, less studied and explored, but people even call this as the second brain. I even have a book. Oh, okay, let's say here. I have a book here. You can see The Other Brain. Why other brain? Because there's so much of neurons in this enteric nervous system. They are like a second brain, while it's more likely to be autonomous, that we don't care. So bolus of food stuff. So you can see this diagram, that peristalsis is a very nice engineering design, that the back part has to contract while the other part is relaxed to push a bolus of this food kinds down to the direction. So this is an exquisite design, and I think this is very interesting. So parasympathetic nervous system, or PNS, stimulates peristalsis by myenteric plexus. So this is a group of nerves, and the mechanism eventually kind of controls the smooth muscle. And depending on your interest, you can actually get into deeper that much digestive tract in GI tract. Smooth muscle contract in sequence to produce a peristaltic wave. And I think this is very important. So either swallowing, and especially your esophagus, that's very important. And let's see what else we can see. What causes peristaltis to stop? When, oh, unfortunately, there are diseases relevant to that called the ileus. In Korean, 장폐색. And when it happens, stops peristaltis and prevents food particles from passing through the tract. I think this is devastating disease, dysfunctional condition that normally we don't appreciate much, but I think that's why we do need to study and understand this peristalsis and how to make it better. Yeah, the answer is running, jogging, swimming, dancing, whatever. You have to move your body parts. So I think this is a very interesting question. Hopefully, this makes sense for you. And Janice asked about what happens if fluid balance, losing the balance, what happens? Yeah, Janice, yeah, I think I remember like cholera, something like infectious disease that causes a lot of diarrhea, and that just quickly kills the patient in very short, within a few days. So this fluid balance is such an important function, I think, especially when, so fluid balance, we already discussed the amount of lost, we ingest the same amount of taking in. So input and output. So that's fluid balance. And somehow why water fluid is important, more than half. Like it says, for women, 52%, for male, 60% is fluid. So fluid is very important. So inadequate fluid intake or loss leads to dehydration. And you can actually ask question why dehydration matters and why it can be problematic. Remember, your cardiac output, cardiac function is it's a pumping. So you need that blood plasma that if you lose your body fluid, it can affect your heart function, at the same time your kidney function, and that's very important for electrolyte management. And also maybe urine production can also be affected, and this is relevant to renal. Like liver, we can't live without kidney. Luckily, we have some kidney replacement of so-called dialysis machine, although that's too huge that we can't carry with us. All right, so regarding your question, what will happen if we have an imbalance of body fluid? You see, because of this effect on heart and kidney, your blood pressure change, you can't breathe very well, you can be confused, very fatigued, nausea, vomiting, kind of a process, and heartbeat, you have a irregular heartbeat. Of course, this all are common symptoms when you have this issue of fluid imbalance. Of course, that's very important. And another aspect of fluid imbalance is actually called edema. And those who have gone surgery, especially breast cancer surgery, we took off all this lymph node nearby and to just remove cancer cells. But the problem is fluid imbalance can happen. It causes edema. And what is edema? Edema is a leakage of fluid from vessels into the tissue. So the tissue swells and it looks very ugly. Not only ugly, it can be very painful. And that's also kind of a local fluid imbalance. Okay, hopefully this makes sense how important and interesting the body fluid balance is. Okay, let's see. Okay, this is the end.